Joanna Macy, the great environmental activist and systems ecologist, said that when faced with planetary crisis, there are three stories we can tell ourselves. Business as usual, in which we tell ourselves that some degree of damage is necessary for human progress. The great unraveling, in which we tell ourselves that mass ecosystem destruction is inevitable. And the great turning, in which we tell ourselves that evolving the way we live is the only way forward, and that we're at the beginning of one of the great projects in human history. On this podcast, we talk to people who are writing that third story, with their own work and their own lives. Mission-driven leaders who are dedicated to social and environmental impact at this critical moment for our species. Welcome to The Turning Point. So Ian, what are your feelings about health insurance?
That is a trapdoor loaded question, but I think it encompasses all ends of the continuum, right? Perhaps it's a necessary benefit, right? Obviously, health outcomes have improved over the course of Western medicine, but I think it's also an unnecessary evil in the sense that health insurance has really it's a terrible word, but like bastardized healthcare in general.
Right. So today we're talking to Sarah Brown, good friend of ours, good client of ours. So she's the founder of Gatherwell. And of course, what attracted us to her and her business was that they figured out a way to do what's being called direct access healthcare, right? So people can skip the insurance game completely and they pay direct for common healthcare services and preventative. And she even offers some more boutique services like weight management and overall health management. And she's a really interesting person. She began her career in mainstream health. She was both, an RN clinician and an administrator. And she ended up feeling the same way that you and probably a lot of people feel about mainstream healthcare. So we've gotten to know her and worked pretty closely with her over the last year. And we've really come to admire her mission-driven orientation, how passionate she is about making healthcare more accessible for people.
Yeah, I mean, the thing that I appreciate about Sarah so much is that it takes less than a minute of interaction with her to just know that her heart's in the right place. You know, she is coming from such a space of genuine care and authenticity and a deep belief and conviction that there should be more transparency in healthcare. She's a fantastic human. She's not only awesome to work with, but clearly beloved by her patients, which is something that, and team, right? Her colleagues, which is something that's a testament to the fact of Gatherwell's success. So she's a delight to work with. And if you have, any rageful fits about health insurance, this will be a good episode, and also one that provides some unique insights or perspectives into things that we could do differently and things that you as an individual could do differently today to address some of those frustrations.
Yeah. And in addition to that, she's another person with that entrepreneurial spirit. And I think it's interesting because you and I often interview people who are in technical spaces or, in the climate space where we commonly associate that entrepreneurial spirit. But we don't think about people like her in the healthcare space. So seeing someone like her in this really staid, old, dysfunctional industry is really cool. And I think she does, like you said, she has that angry dissatisfaction that you see in a lot of the entrepreneurs that we meet, but she brings that spirit into this very stodgy, very complex space. And it comes out of her all the time. And it's just not what you're used to seeing in healthcare. And, if you talk to a doctor or you talk to a RN. So really fascinating person, really fascinating business model. And we're looking forward to introducing her to more people right now. So please enjoy our interview with Sarah Brown. Hey, Sarah Brown, welcome to The Turning Point.
Thank you so much for having me, Justin and Ian. It's so great to be here today talking with you guys.
Good to have you too. We're excited for the conversation.
Yeah,
Buckle up.
Good to see you again, Sarah. Yes, we'll buckle up and get down to business. So just to get us started, you have been in big mainstream healthcare and now you have this entrepreneurial venture you've started yourself. Talk to us about what are the primary ways in which big health is letting people down or not serving patients adequately.
Yeah, I think first I just want to put a disclaimer. Working in big health, I'd never heard that term before, but I like it. Sometimes I say traditional healthcare. All the people I've worked with in it are good people. We have really bad processes and systems, and people are siloed in it. and they don't understand that some of the work they're doing every day is part of this larger broken system. But even on that note, like doctors have a higher suicide rate than the average population by 50%. So there's like moral injury at a deep level happening to people because they know they're part of this bigger problem, but they don't have the agency or ability to really make big changes alone, and yet are somewhat golden handcuffed into an industry that they started for good, altruistic, good reasons. So people are good. I don't want anyone listening who works in big healthcare to feel like I think that they're bad people. I think our system is just fundamentally totaled, broken. And when you think about like the world of like car insurance, when a car's totaled, you don't put more money and effort into it. And that's where I got to.
Okay, that's pretty stark. Could you maybe
Is
give
it
us
too
a?
aggressive? I'm sorry.
No, no, no. That's
Not at all.
not at all. That's what we signed up for, Sarah. Uh, we've never been in healthcare. We don't know what the issues are. So could you give us maybe give us some examples of how it is that the healthcare system is broken?
Yeah, I would say the big picture is the people paying for it, healthcare are not the end users receiving it. And so who defines value and who drives how we operate is largely by people removed in siloed positions. So insurance, big pharma, those people play a big role in how healthcare is experienced for a lot of people. And again, even people who work in those industries, they only have their siloed piece. So I think a privy that I had is like I started my career in administration and then I became a clinical provider. And so I have a unique vantage point of like understanding some more of the silos because I know what it's like to be the provider, and I also know what it's like to be on the administrative side and try to make budgets work. But I think one of the big things is who's paying for it, is defining values where the end user isn't getting the value. The cost of the care is so high. Here's a fun fact: about 7 cents for every dollar paid in traditional healthcare is actually reaching the provider. So people have a misrepresentation that doctors are out there and they cost so much money because they make so much money, and doctors do have good salaries. But it's you're not paying a doctor half, not even half of what your bill is. 7 cents for every dollar spent. I think insurance premiums are just out of control. The average working American is spending way too much of their income on premiums that get you really zero care. And then by the time you get the care, you still are paying a deductible. So looking at literally every dollar spent on healthcare, the pay to even have access, which access is worse, is just uh, it's just crazy. The value is just not there. But there is a underlining fear that we're all bought into of if we don't have insurance, we're going to die. Well, newsflash, we're all going to die. So I hate to spoil the end of the story, but how we live is really important. And traditional healthcare outcomes don't lead us to good places. And that real awakening happened for me spending a lot of my career in long-term care and just seeing where we end up if we follow the traditional healthcare path, usually on way too many medications, causing a lot of issues, and not a focus on quality of life and what matters most to the patients. Another big problem, I think, in healthcare is that we have created a mindset in general population that when we're sick, it wasn't our fault and the doctor should fix us with a quick pill or a quick fix. And so lifestyle often gets left out of the equation, and that self agency or empowerment is sometimes left out as well. But those are just a few. I mean, I could really go on all day, but if I had to like pick one or two, I think we need to start voting with our actions and realizing even if our employer is paying for our insurance, ask your employer like how much of your premiums are they covering, and what is that total cost for you just to have a plan that says you still need to pay another couple $1,000s before any care is rendered. And then you look at that impact on the business, and then we as consumers need to start actually kind of caring about the real cost, and is that cost getting us what we want. um, and then, yeah, because the systems are so set up to appease the insurance payers, then we've got care that really is substandard, and time a provider has to actually provide good quality of care is so small that, this is overgeneralization. But if you go to the ER you aren't getting like a full health check and like you're just getting stabilized and discharged and then said to follow up with primary care. You go to primary care and they have appointments stacked on top of each other that, they really don't have time to dive in. And, I don't want to get over, I don't want to get over zealous on like, and then they just sort of see you and get you out and tell you to come back in a few weeks, because again, it's really good people doing the work, but they're in a system that's just so hard. So then people get discouraged, they turn away from healthcare, they're functionally uninsured, they can't afford it, and then the rest of the world wins out with voices telling us, it's okay to just live this way and lifestyle doesn't matter. But the good news is that there is a turn in like the current environment, I think, of people really realizing healthcare is broken and wanting to have some self-agency in taking care of their healthcare. And there are people that are taking bold steps out of the traditional system to prove proof of concept that there is better, more affordable ways to provide care and wellness. And that starts with prevention and partnership and empowerment with the patient. But the big problem is like the big players in the game, they just aren't incentivized to make a new model. It would mean most of them don't have a job. And so that's a really hard part. So it takes like little guys kind of coming together, and then it'll, slowly, hopefully you get the early adopters, the late adopters, the middle, eventually people will be able to say like, yeah, this way is better, is my hope. Because until we start kind of voting with our actions, we're going to just keep buying into a system. I mean, people's premiums this year are going up in the 20s to 30%. And some people are still like, and now my insurance just costs more. At what point are you going to be like, 100% of my paycheck goes for my benefit? Like, when are you going to realize it's not a value? Anyway, I guess I
Okay.
have some opinions on it.
So I just want to pull out a couple of things you said. 7% of your dollar goes to the provider. Where is the other 93% going?
Overhead and administration costs and contract deals. So, for example, this might be more like understandable to the average like person that consumes healthcare. You need to go to the doctor. The first step is you usually will call, or you can go online and schedule, but there's usually some sort of pre-visit thing where they're verifying demographics. The main reason they're doing that is if anything is off on those, insurance could reject a claim. And even if you get it all right, insurance is likely going to reject a claim. So you've got your front end scheduling staff. Then you show up in clinic. You've got someone at the front desk that checks you in. They go over those demographics again. As a patient, you're already annoyed. So you're not the one that has value add here, right? You're like, I already told you that. My address hasn't changed. My insurance is the same. By the way, they also have systems where they can look up your insurance and verify it, but they still want a copy of your insurance. So there's just processes that are just extra, and you do that time and time again for each patient. I'm just pointing out a few. Then you go to the waiting room, you get called back by an MA. The MA rooms you, they take your weight, your blood pressure, they might do your medication reconciliation, ask you why you're there, tee some stuff up for the provider because the provider doesn't have time. They put all that in the chart. You feel like you just got in and you just shared your whole heart. You wait a little bit, the provider comes in. Now, in the perfect world, that provider maybe looked in the chart and saw what the MA put in, but most of the time they didn't. So now, why did the MA spend all the time doing that? Well, now you can upcharge that visit more because you did MedRec and you did all these other pieces. And were they even relevant or needed for your appointment? And again, we could make the claim that yes, it always is. But if the doctor's not even looking at it, how important was it? Then you go in and talk to the doctor. They have such a short window. You're in, you're out. Then the doctor has to spend time putting a note in and making sure they document all these things that happened. And the way they document is they kind of have, it's coding. They speak in code to be able to tell the insurance company what they did. Now, you can code it one way or another way, but there's more reimbursement on either side. So then you've got these systems have coders who go in, review the doctor's notes, and sometimes remind the doctor, are you sure you didn't spend more time with them? Are you sure you didn't cover more conditions with them? Oh, yes, I did. Oh, go back and edit your note, because now they can legally, bill insurance for more. So then they send it off to insurance. Claims get rejected all the time. So there's back and forth trying to clean those claims. By the time you figure out what the patient actually owes, they're so far from receiving the service. They get their bill in the mail. most of the time people are functionally uninsured and don't even have the money to pay their bill that they're so surprised at the cost of, because they're like, what? This is crazy. I only did this and they charged me all this, and they don't know how to even read their bill. So they don't pay their bill, or it takes a while to pay them, or maybe they paid it, great. But then it often goes to internal collections. Then after internal collections, they still can't get collected on it. And so then they're like, we have no money because we're not getting paid for our visits. But then they sell the debt off to these collection agencies who buy the debt for pennies on the dollar, who then continue to try to collect money. And so if you look at all those touch points, that costs a lot of money, right? And so that's where a lot of the waste is. That was a long story.
No, but I think that's a story people need to hear, Sarah. I just went to the doctor a couple days ago, and I went through exactly what you just described. But to us, the patient, that's completely invisible. So that's really helpful for people to hear. So tell us what Gatherwell does in terms of creating a direct care model and how it's different from that.
Yeah, so the big thing that where we fall in with direct care is that insurance does not dictate care. So we do not contract with any insurance companies, because if you start contracting with one, they all borrow the same contracted language. And there's a little bit of a mentality of, if you're not a contracted employer, you'll never make any money and no one can see you. And that's just not true. But you've got to be willing to take a stance. If you're going to contract with insurance companies, then you're going to play by their rules. And there's some things they're just going to say are not covered. They want you to provide the cheapest care, or they want you to try multiple treatment plans and document for 6 months that they failed until you can move on to something that will really work. And so it takes individualized care really out of the picture. So for us, direct care means that the patient works directly with us. There's no middleman that's deciding what is best care. Obviously, we need to stay within standard of care, and also, stay relevant to the changing, emerging knowledge we have in the health system, and be a good steward of that knowledge to our patients too, and letting them have some say in their care. But yeah, it's really, patients are more in the driver's seat, and they're that a deep level of respect for the patient, that at the end of the day, they are most incentivized to feel better in that visit. I care deeply for my patients, but honestly, they're going to go home and they're going to care a lot more about their symptoms, and I'm going to be moved on to the next thing. So they're going to spend more time in this day and age of access of knowledge. People can do so much research, especially when they're suffering, that when they come to me and they've done research, there's utmost respect of like, what have you figured out? And what do you think you have? And what makes you think that? And here's what I know. And here's what I don't know. And here's what we can learn together. And here's what we could try. And hey, there's always hope. And sometimes I just even see myself as a hope dealer of like, there is always a reason to have hope. Our bodies are miraculously made, and we can, you've got a partner in me to work through this together. So direct care really is putting that patient to provider direct without the middleman.
This sounds like a TV show title, perhaps. Instead of Sarah Brown MD, it's Sarah Brown HD, Hope Dealer.
Oh yeah, that's a good one. Actually, I should take that. My neighbor always wants to call me Dr. Brown, and it really annoys me because I'm not a doctor. And I have so much respect for doctors that, like, yeah, you went through different type of more grueling school and residency that I didn't have to do. And I'm not going to go by the name doctor when I'm not one. And so he always does it to bug me, but I'll just tell him, no, I'm an HD. I'm a hope dealer.
Right. Also, you are from a certification standpoint in NP. So for anyone listening, yeah. Sarah does have a lot of certified knowledge. So just to pull back to something you said earlier and that you're again referencing now, you talked about, I guess I would say, patient agency. You said when you were talking about the mainstream healthcare system, you talked about people having the expectation culturally at this point that being unwell is not my fault and the doctor should fix me and give me a pill. You're describing a very different relationship with your patients. Are there certain types of patients that are better suited for direct care?
Yeah, so I'm like an includer by nature. So it's like whenever I get challenged with these questions, it's so hard for me to be like, everybody should learn this. But yeah, people that are like, there's kind of like two sides of the bell curve, because this is new, that I find like that is attracted to our type of practice. One is the early adapters who see that the current system isn't working and they want to be proactive in their health and wellness, and they're following along with some of the really cool things in health and wellness. And then I'd say on the other side, people who have exhausted every effort in traditional healthcare and have been left with no answers. But we serve the middle too. So it's, but I feel like the real need, the people who are seeing the need the greatest are people on either side of those bell curve.
Yeah, and it almost sounds like you're in the middle of helping to educate people at the same time, right? Like the way you're describing it, it sounds like there's a dysfunctional codependency that has developed as a result of the way our healthcare system works, and that you're helping not only to offer something different, but also invite people into a new way of advocating for their own health and being more agentic in the way they seek healthcare.
Well said. You're always good at the words. Yes.
They used to pay me for it. So, given everything you've told us, this sounds really attractive to someone like me, and it sounds very rational. Why is it so rare to see a model like Gatherwell, and why is it so hard to pull off?
Well, it kind of starts with schooling, like in belief in entrepreneurship. Like I wish earlier in my life that someone would have told me I had it in me to be an entrepreneur. But like as I started, I went through, I hate using the word indoctrination, but like in some ways you work in a clinic and you just get told things, and like especially in long-term care, we're told to do things because and there's usually a rationale, and on surface level it's acceptable rationale, but when you really dig deeper that's not really the answer. So I think when you get started, not a lot of people go to med school and then get their MBA before they ever start practicing, and once you start practicing in a larger system you get so deep. I mean, literally the phrase is called golden handcuffs. Like now you've got this safe job in terms of paycheck and benefits, and also respect. I mean, there it's the path you go. Also your entire training you were also being taught by these same people to this is how healthcare works and these are the norms, and then your schedule gets so full that you don't really have time to go out there and do your own research and learn things. So it's like having that combination, I think, makes it difficult entry for doctors, and because you can't start a practice if you're not a doctor without, or a NP, with, or a DO, or um, a professional license. You can't just go and start a medical practice. And then if you're going to try to start a medical practice without one, good luck finding one and being able to pay them that much at the beginning of a startup. So I think it's a little bit of, it goes back to money, I think.
I was absolutely thinking about like the challenges. Obviously, we've talked about the challenges from a systemic standpoint in the space. And as someone who, uses direct care as part of my own healthcare routine, I also find myself thinking about the challenges for the organization that is offering direct care within the industry space. Like I know that the direct care is something that's it's kind of coming online over the last few years. I think there's been a rise in it. And so I think it's still, I mean, this is my understanding, is it's still early, but it's also like still very small players within a very big system. And so I'm curious, Sarah, if you could just explain or elaborate or expound on what are some of the organizational challenges that you've experienced trying to do healthcare differently, um, as as a direct care provider?
Honestly, the biggest piece is if you let fear win, because like the society norm is that like doctors work for these large health systems, or how are you going to have a network of colleagues if you're a standalone clinic? Standalone clinics can't make it on their own. And so it definitely is like a lot of courageous providers coming out together and banding together, to support each other. And so systems where, our medical record, I can, at the click of a button, ask a specialist to consult on a case or see a patient. And so that's built up some confidence because I know I don't know it all. Also having colleagues who've also stepped out and done this, and having each other to lean on has been really helpful. But there's also perks where like I feel real bad for people working in the system because I don't think they realize like it's so draining. It's so unrewarding to be part of just this totaled system that you don't really have any agency yourself to like make any change, and you go home drained and frustrated and not really feeling like you're helping patients and wonder how the heck you got there. So I would trade all the headaches of being a small provider for the wins that I get to see when patients are like having such good outcomes, and I leave at the end of the day with purpose and passion. And like it for me, like my prayer is, Lord, provide for me, and that happens. And so the cool thing is that you almost have to like start with people who are either okay not having the big paycheck, or they didn't start with the big paycheck, because that's the hard part, right? Like if you've started in a healthcare system and then to take a step out, you've got to be okay with not making as much, or have other revenue streams, or however you might do it. But I think in terms of like living a purpose-filled life, is, no money in the world really can change that. Because why work so hard and then you buy all this stuff and you have all this stuff, and then when are you going to enjoy it? Because your brain is constantly like, oh, I have so much to do.
Well, thanks for being so frank about that, Sarah. I mean, I think that's a reality everybody needs to hear, especially when we're talking about entrepreneurship and, making changes in a very, systematized and, difficult to change space. So is it possible as Gatherwell grows and as you establish your model to start to, achieve some of the financial rewards you would have gotten within the system?
Yeah, I do think that there is that opportunity, because to be in business, like I had a friend who told me, if it doesn't make sense, CENT, it doesn't make sense, SENSE. And like, because I never like, I literally feel like I fell into entrepreneurship because I'm like, I think there's certain aspects that like entrepreneurs have where they're just like, yeah, like I don't really care, but I'm just not going to stay in this like problem area too much longer, because your brain every day is thinking about solutions. And then like to be an activator, like I am, it's like I got to do something different, or I'm literally going to just die doing this every day. So like that I think has um helped. But the finances, the funny part is like um it's just ridiculous how offering services at a price that is so much less still has margin, like that I can provide good wages for my employees, I can cover expenses, I can provide a good life for my family. So yeah, there is financially it does make sense. So it's not like if you wanted to go this model, you're going to have to just agree to be poor, and live on ramen noodles and whatnot. But it's there's startup time, there's investment time to get to your critical mass where it makes sense, and that part can be hard. Another barrier to entry, I think, to note that a lot of people don't know is that when you are a provider in the traditional medical system, you have to be credentialed or contracted with insurance. And one of the largest one is like with Medicare, Medicaid. And once you are contracted with them, you're locked in unless you write them a letter saying you want to opt out. And then what happens is you get told if you opt out, you have a 90-day grace period to make sure you don't want to change your mind. But then for 2 years, you are out. So you have to believe in yourself that you can make it at least 2 years without being reimbursed by insurance. Because if you can't get reimbursed by those insurance payers, you're likely gonna not be like credentialed with the other payers, from my understanding. So that whole thing really traps a lot of people in, because most people's first job to get experience is going to be in a larger health system where
Wow.
they're forced to be credentialed and sign that contract.
I have never heard that before. That is as if there aren't enough barriers to entry.
Right. So like when I look at adding providers to my practice, it's like a lot of them would say like in a heartbeat, I would love to do it, but I need to make sure I can continue the lifestyle I have with my family. And I don't think I can move over. So like that is a barrier to us adding more providers, is like, how do I get to a point where me and my team are making enough to to, in fairness, offer a provider a comfortable salary before we bring the patients. And so it's like a chicken or an egg. So it does take courage and faith that it's the right direction to go, or maybe like winning the lottery or something.
Man, I'm trying to think of other industries where that would be the case, where there would be that much of a penalty for stepping outside of the established realm. The only one I can think of is like law.
So the only like
Yeah.
caveat to that is if you provide emergency services. So if there's any emergency service providers listening, Medicare will cover you, but that then you're also looking at policies of larger health systems. If the hospital will allow you to work and not be contracted, then Medicare may cover you, but or you may still be able to be reimbursed for services you provide. Um, but then it's hospital policy too. And so there's just so much red tape and bureaucracy to get through all of that. But I think we're going to get to a point where emergency room doctors may start doing this, and then larger systems have no other option but to allow that for that emergency clause.
Wow, that's fascinating. So, if I could pivot just a little bit here, Sarah, one thing in working with you, I have learned more about GLP-1s than I ever imagined I would. And it also strikes me as an example of how you're able to take a really personalized approach to the way you work with people. So I was wondering, is there any way that in like a concise manner you could help people understand how GLP-1s work and how you have this slightly different perspective on how they work and the benefits they have for people?
So GLP-1s naturally exist in our body, and they are a peptide. And so, kind of in layman's term, a peptide acts like a coach to the body, kind of shouting out orders, do more of this or less of that. And so it helps with hormone regulation of the foods or hormone regulation for hormones that regulate our appetite, our satiety, feeling satisfied with what we eat, um, and our metabolism and digestion. And the older we get and the more our environment is just not ideal, we start to have less of this signal. And so metabolic dysfunction is rampant and widespread. And some of it is lifestyle and patient decision choice related. Some of it is genetic related, and some of it is environmental related.
Can you say more about the environmental part of it?
Yeah, so there's a lot of things that are put in our food supply or in chemicals that are endocrine disrupting. And because of that, it affects the way our body acting as optimal as it should. I was like blown away to learn this, that like the food supply industry will have like different food lines for, let's say they're making Fruit Loops for America or Fruit Loops for over in Europe. There's certain things that are banned over there that are used to increase being hyper palatable, so people want to buy more of them for consumerism here. So they leave them in the US, but because they're banned overseas, they take them out. So like that's just crazy to me that we know we're harming people, but because of profits and consumerism, we're just going to still put stuff into people's foods that then do have a physiological effect on their body. It's like we're giving people, you know, drugs without their consent because it is affecting their body. But you could boil that down even bigger. At the end of the day, food is medicine, food is fuel to your body, and what you're putting in your body definitely affects you, but also the things around us that are in different, you know, chemicals or things that we're exposed to. But another one that people sometimes may not even realize is just culturally how we behave. Living in constant stress or being constantly on all the time takes a toll on our body, and how easily our body can sort of modulate and balance out. We're meant to rest, we're meant to be active, and there's a circadian rhythm to that. And so constantly living out of your circadian rhythm is also going to have take a toll on your health and how well your body functions. So when it comes to a GLP-1, they're one of many peptides in the body. And by supplementing your body with that, it kind of is like a coach who gets a little bit harder on you and says, instead of like, hey, you can do it, it's like, I know you can do this. Take can't out of your vocabulary. We're going to do this. And the body's like, okay, we're going to do this. And that's kind of in layman's terms what a GLP-1 does. The cool thing at the end of the day, what it's really doing is it's helping level blood sugars, because having level blood sugar is is kind of creating an ideal environment for the rest of the body systems to do what they're supposed to, which is why these drugs became popular for, weight loss, and weight loss makes billions of dollars every year, right? But like, this is a weight loss strategy that it's fun to say results are typical. But at the end of the day, it is really helping more than just weight loss. It is helping improve cardiovascular health, reduction in cancer risks, improvements like fatty liver, hormone regulation, thyroids are getting better. People are getting off of blood pressure meds, just even cognitive function, because when blood sugar is constantly going up and down, your body is like constantly being stressed. So I like to tell my patients to think of it like if you were at work and the fire alarm went off, like for me at least, I'm like, cool, is it a real fire this time? What's going on? The first time. But if I'm trying to get work done and all day long the fire alarms are going off, I get to a point of unproductiveness. Like I'm just, why I can't be here. It's not working. And I feel like our body systems are saying that to us when we're constantly having blood sugar fluctuation. And then in traditional healthcare, you're not usually going to pick up on that metabolic dysfunction until well into even diabetes, because criteria to be considered a diabetic or having a blood sugar issue, you need to have 3 fasting blood sugars over 125 or a hemoglobin A1C over a certain number. And so both of those, a fasting blood sugar is kind of like me saying like, hey, I'm going to see if you're a good house cleaner, but I'm going to come Saturday at 2, right? Like you're going to make sure the house is clean. Okay, you actually have no problems with cleaning, but you're like, hey, but you don't realize the rest of the week it's like a disaster here. And then a hemoglobin A1C is taking the average of the last 3 months, but it's taking an average. So if you have a peak and a drop, you can still have a pretty clean average, but it's those fluctuations. So somebody who's like, I don't like meds, I don't like these GLP-1s, I don't want to do it. I totally hear you, because working in long-term care, I am way more conscientious about medications. Why are you on them? What are they doing for you? And tend to lean more towards less medications are better. But for this one, it like looking at your blood sugars is a key indicator of health. So wearing something like a continuous glucose monitor is something I would recommend for someone, because if you're seeing those big variations, either start eating to reduce those variations. And if you're eating really healthy and you're still seeing them, you may have metabolic dysfunction that needs a little more support. And there's other ways to go about it too, especially in functional and wellness side of things. But in terms of for effort and on return and, GLP-1s, I was at a conference and a guy was saying GLP-1s have transformed the health and wellness as much as the introduction of penicillins, just because of how much they have changed the outcome in the health and wellness of people. And I see that every day. And it's not like the cheat or easy way out. I mean, for somebody who has struggled with reaching satiety and having your body not constantly sending you signals that I'm hungry, I'm hungry, I'm hungry, and never reaching full, like this helps people to be like, oh, this is why people say you can follow a diet, because your body isn't constantly sending you signals of you need more. So yeah, that's in a nutshell, like I do think they work for a lot of people. There is a side to them, like any drug or medication or anything you put in your body, there's always going to be risks to. And so the biggest downside of these is that when people get on them, it becomes really easy to not eat because you're just not hungry. And if you've struggled with weight your whole life, not being hungry and not needing to eat, people have very strong willpower around food. And if you remove that food noise, because they've worked their whole life to resist food, and now all of a sudden they don't have the drive to tell them to eat, they can malnourish themselves very quickly. So it's so important to talk to them about mindset going in of, if you're going to be on these, you've got to think about food as fuel up front. You need to know how many calories you need to be consuming a day, and then you need to be conscientious of those calories. Your body needs at least 90 grams of protein a day. When you're eating protein, you can really only digest about 30 grams every 3 hours. And so making sure you're planfully eating and consuming food, because the stupid part is like a lot of people are getting on these uneducated, and the first few months on it, you're just not hungry. You've lived that lifestyle that's told you to stop eating, and you're not hungry, and you're just dropping weight and you love it. Well, what's happening inside metabolically is you are starving yourself and your body's going into like protection mode. So it's actually slowing your metabolism to help you sustain. And then if you continue that, and that it's not painful or annoying or uncomfortable to you that you're depriving your body because you're not hungry. And so you don't have that cue. And so then you malnourish yourself. Well, then eventually your body pulls out the next protective mechanism, which is really metabolizing your own protein. So one of the things we do is really make sure that we are monitoring your body composition and coaching you on food as fuel. We also give our patients access to an app where they can track their food. The body composition scanners we do will actually tell them how many calories they need every day. And those are things that are really important. And always starting with the end in mind. Like, this isn't just a quick thing to jump on to lose weight, to go on a vacation. It's really about changing your lifestyle and getting your body modulating into a wellness level that you can sustain. And so being careful with them is important, because if you malnourish yourself, then you start to see the side effects like hair loss, poor skin, gaunt look, extreme fatigue. On the flip side, people also have a problem with thinking more is better. And so a lot of people will just jack up their dose on here or rush to max dose too quickly when more isn't better. And that's where you hear about the side effects of like vomiting, diarrhea, explosive diarrhea. Like, yeah, because they're giving their body way too much. And then on the very extreme side of way too much, issues with like pancreatitis. So there's the good, the bad, the ugly side of it. And then, so just like buyer beware type of thing. But it's a complex problem and a complex issue, and it is transforming the life of so many people. They're even studying it now for addiction to help with reducing cravings as people are trying to stop drinking, and so there's just a lot they're finding benefits from semaglutide on.
So I want to I want to play a little bit of a, it's not necessarily devil's advocate, but like we've spent a lot of time talking about the extremes, right? Big health, some of the challenges, benefits of taking care of yourself. But let's just say I'm, quote unquote average, whatever that means. I understand that big health is a system that doesn't function properly and doesn't serve me always, but I'm not the type of person who is listening to health podcasts on my commute or talking with ChatGPT about how I might be able to help myself, or I'm not using a continuous glucose monitor. I'm just kind of somewhere in the middle, right? I'm not super motivated to take care of myself, but I'm aware that I might not be getting what I want or need from big health, or there might be some gaps in my coverage. For someone who's listening, where do they start, right? Like, if they're going to go find, like, hey, I'm interested in this primary care concept, and let's say they get on the internet and they Google and they say, I want to take the next steps. What are the things they should be asking of those potential providers? What are the things they should be looking out for? And what should they have in mind if they're not someone who is by nature already really invested in their own health journey?
Yeah, it's such a hard question to answer on the aspect of like everyone is so different. But I would say if you're satisfied with how much you're paying for healthcare and you are getting good value for the money you're spending, great. But I think the awareness that people listening to this is like figure out how much it really is costing for you to have healthcare, and then really understand the goals that you have for yourself. If you feel like, hey, I'm pretty healthy and I don't really need the doctor and things are fine, then like, cool. Maybe you don't need to be paying so much for your healthcare then either. But I think redefining value for yourself and what it means to have service for wellness, and not just buying this belief that like you have to have insurance or you will certainly die. And I'm not like saying that insurance is bad, but I think we could move much more into like one-on-one sort of type healthcare and having more catastrophic care, because when it comes to life saving, we do that really well. Catastrophic care, we do really well in our health system. So I'm not saying that our health system is altogether bad. It's just lacking a lot in the wellness and the individualized care of really listening to somebody and having the time to do that. So if someone's satisfied with how they're currently getting it and want to stay in that space, like there's no, good. But I hear way too much from too many people. There's not a lot of people I've met that are like, I love my healthcare. I love the price I pay for it. I don't hear that. So, but I think a lot of people just don't even realize there's other options.
That's pretty sensible.
It's sort of like
What?
no other industry, maybe there's others, but like I'm just talking off the cuff here, but like what other industry would you be like, yeah, I'll keep paying a ridiculous price and getting nothing for it? I don't know.
I don't maybe cable or internet. I don't know. But anyway, Sarah, we're going to move on to sort of our closing questions.
Yeah.
Okay, so you've talked a lot about the system, Sarah. What is the highest leverage system level change that would help operations like Gatherwell serve the population?
Oh man. Well, I think that that might be a really hard thing to answer because it's such a complex problem. But at the end of the day, people that are in the broken system are also people. And so, I get a lot of referrals from providers who want to do what I'm doing but can't because the system they're in. So
Mm.
I think what it's going to take is just each person really realizing what they want and voting with where they're receiving care. I don't know that there's a high because you can't take away everything too quickly. So I think the answer for me personally, what motivates me is if I can be a part of the solution and help prove like efficacy or demonstrate, viability and efficacy in this model, I hope to inspire other providers to join in. And until we have the new system built, you have to live one foot in both worlds. And I have to do that myself. Like you've got to be able to talk both industries or both sides in this in between because you can't, there's space, there's need for both right now until we reach a critical mass.
Mm. It's interesting. We honestly hear that from change makers in every domain, even when it comes to agriculture, climate. Everybody is in this space where in order to make change, they sort of have to walk with one foot in both worlds. It's interesting that you say that. So, with that in mind, what is some advice you might have for other founders or entrepreneurs or change makers in your space?
Just do it and live with courage. Don't live in fear. Don't lead from fear. Throw it right out the window because it will paralyze you. And know like your gut intuition and instinct about how you want to be a human on this earth and how you want to impact other people. It does make a difference. You don't get a choice really to be neutral. And so go for it. Call me if you want help and I'll learn from you and you'll learn from me.
Is that permission to post your phone number in this podcast, Sarah?
Yeah, maybe like do our website and then if they can find me through the website, then that's great.
I do. I want to ask one last question, Sarah, which is for the individuals listening. Obviously we're all consumers of healthcare, but if we're not a provider and we're just a listener and we're a consumer of healthcare, what is one individual thing that we could do to advocate for our care in such a way that kind of moves the bell curve of the entire continuum in a positive direction?
I think to summarize it, ask why and be willing to consider other alternatives, continue to advocate for yourself, but really find out how much yourself and your employer are paying for you to have health care and then just think creatively, not even that creatively, like look up direct providers in your area and see how much you could get for that same price. You'd be blown away. So just voting by your actions is huge, but if you're not quite ready, ask why and advocate for yourself at the doctors because you are most incentivized to feel better and I promise you that the system doesn't have your best interests at heart. And so the people are good, the system is broken. So it's really hard for me to tell you to like just keep getting that same broken system because you'll probably end up over medicated and not well.
Well, Sarah, thanks for all of your candor. And I hope that the people who listen to this learn as much about healthcare as we have from you over the last year or so.
Thank you so much for having me.
Yeah, thanks for coming on, Sarah. Great as always to hang out with you.
Yeah. Same.
Thanks,
Take
Sarah.
care. All right. Bye, guys.
Big thanks to Sarah Brown of Gatherwell for coming on the show today. Gatherwell has multiple locations around the Twin Cities metro, and you can check them out at gatherwellmn.com. That's all one word, Gatherwell and the letters MN. And if you're a mission-driven leader or founder looking to grow your impact, you can check us out at stillpointinsight.com. Thanks for listening, and we'll see you soon.